So you might be wondering, why does my shoulder pain come back time and time again when I try and add back in overhead lifts into my programming or my upper body workouts? Well, in this video, we're going to be covering some of the most common causes and take a deep dive into the mechanics behind the shoulder so you can visualize what's going on whenever your shoulder starts to flare up or you have limitations in being able to do pressing movements so that we can have a better idea and understanding of what needs to happen in order to fix this problem for good. So commonly we'll see people be able to do lifts and do their upper body workouts with movements down below shoulder height. They're able to get through the entire program or workout without aggravating their shoulder pain. However, as soon as they start adding in any sort of pressing variation, especially using a barbell, even more so than a dumbbell, they'll start to create pinching or create inflammation around the shoulder that sets them back for up to a few days after the workout and really gives them pause for concern in terms of whether or not they should continue doing those movements. Unfortunately, removing a lot of the painful movements from their exercise program indefinitely. We always want to help to set people up for long-term success and open their eyes to what is possible when you address the root cause of the issue. So in this video, we'll be able to visualize. We're looking at the back side of the right shoulder here with a barbell press overhead. This purple muscle is the supraspinatus. It's one of our 4 rotator cuff muscles, and it's one of the most commonly impacted when our mechanics are off with our overhead presses and any sort of lifts up above shoulder height. So there normally needs to be enough space underneath the roof of the shoulder blade, which we can see here outlined in yellow. And that roof right there sits right above where the supraspinatus or that rotator cuff muscle attaches to the upper arm bone on the actual shoulder itself. When we get nice movement from the shoulder blade here, coming up and around the rib cage, it helps to maintain that space underneath the roof of the shoulder blade, and it helps to keep this supraspinatus muscle here happy. When the shoulder blade doesn't move the way that it should, and this roof of the shoulder blade stays rotated down, but the arm continues to move up overhead, we can start to create a problem with compression or irritation of the supraspinatus, as well as some of the other tissue underneath the roof of the shoulder blade. So we'll be able to visualize here. Again, looking from a back side view with this gray bone being the roof of the shoulder blade, and these lighter structures under here being the tendons from the rotator cuff, as well as another structure called the bursa, which helps to kind of lubricate the area and it helps to make sure things move and slide and glide smoothly. One of the biggest issues, along with the fact that the shoulder blade here does not rotate up and around the rib cage, is that our upper arm bone or our humerus here will stay rotated inward. And we'll be able to visualize here how that impacts this space, again, underneath the roof of the shoulder blade and can lead to recurring pain. So as we can see here, if our upper arm bone here actually rotates inward, that will decrease even more space underneath the roof of the shoulder blade. And if we do enough repetitions or use enough weight, we can cause inflammation or potentially cause a tear of this supraspinatus muscle that we were discussing earlier in this video. So how do we go about addressing or correcting this issue so that we're not set up to re-aggravate our shoulder every time we do overhead press, especially with a barbell press? Is we want to make sure that we start to, and we cue ourselves to rotate this upper arm bone in the opposite direction. And we'll be able to see here in just a minute on the video how that helps to open up space underneath the roof of the shoulder blade and helps to take away pinching or compression of this supraspinatus tendon. So as we can see here, if our upper arm bone rotates the opposite way, we will help to free up a lot more space underneath that roof of the shoulder blade, as we can see here, and will decrease the likelihood of providing any sort of pinching or compression to those structures. Here. One of the most common cues I'll give to my patients is to be able to focus on bending the bar forward or trying to break the bar. And what this does is it'll help to cue our upper arm bones to rotate out to the side, as we saw kind of in that previous part of the video here. And it'll help to maintain that space underneath the roof of the shoulder blade. So by breaking the bar, it puts our upper arm bone in a better position, and it helps to decrease stress on the rotator cuff and the other structures underneath the roof of the shoulder blade. And what that means is more overhead training, as we can see with all of these different lifts, without running the risk or reducing the risk of re-irritating your chronic or ongoing shoulder pain.